preparation regimen and as fluid replacement for gastrointestinal losses. Studies may also be done among patients given laxatives in preparation for major colonic surgeries as well as gynecologic surgeries. Additional monitoring of the electrolytes may be done to establish the time frame when monitoring is still necessary to ensure patient safety. A larger sample size will be helpful in establishing its effectiveness. Thank you very much for your kind attention.
Okay, I congratulate you for making starting a pilot study on the effectiveness of that drain, kind of what you are recommending, your isotonic carbohydrate sport beverage. But there is a problem with pilot study because your population is limited and you cannot make a conclusion out of that. So maybe you can continue your study regarding the effectiveness of this beverage and collect some more in order to deliver a final conclusion on its efficacy.
I agree with Doctora, and also with your topic, when you make a comparison, a comparative study, you have to make sure that the two things that you are comparing are most parang they are equivalent. So, do you think it's kung ano parang it's fair to compare distilled water with a beverage drink that you do know that already contains electrolytes?
Good morning, ma'am. So, as I've mentioned, this is an effectiveness study, and an effectiveness study is based on ongoing actual practice in our institution. So, the
So you
ongoing
give-
practice in our institution is
Water,
water.
distilled water.
Yes, they advise their patients to take at least 1 liter of water. So, this is an effectiveness study since this is what is currently practiced in our institution. So, I decided to compare it with a sports beverage in order to first, the distilled water will help in establishing if there is really the incidence of hypokalemia and hyponatremia, while the use of the sports beverage that I use is an intervention so as this will prevent the occurrence of hypokalemia or hyponatremia if ever it's documented based on the use of distilled water.
Okay. Another comment, your review of literature is very long. If you want to publish a paper, you have to make sure it's around only mga 2,000 to 3,000 words. Also, it would have been best if you also looked into the literature of the Philippine Society of Gastroenterology, because as far as I know, they do not recommend distilled water only. So, kasi if you do review of related literature, you have to make sure that what you're covering is parang you have an idea, so your readers will have an idea on it. Okay, so you should have looked into the journals of the Society of Gastroenterology, kasi as far as I know, they don't recommend distilled water only. They give na the like that.
Yes, that is also one of the reasons why I did this study, ma'am, because I may help in my recommendations or suggestions as to the protocol that they are using in their
in your
OPD.
institution.
Yes, ma'am.
Okay.
Ay, sorry. Okay. When you mine is mostly concerned about medical writing. When you read through the manuscript, putol-putol siya. So, andyan yung line of thought, tapos biglang naka-separate, iba na namang topic. When you do a literature review, you review, for example, this is about the effectiveness of a certain preparation versus a placebo or another active, anong tawag dito? Active intervention, no? Dapat yung lit review nyo limited dun sa ganung types of studies. Hindi yung halimbawa study regarding colonoscopy, study regarding yung ganon. If you read through the manuscript, dapat yung flow niya o leading towards a significance of your study. Pati yung mga tawag dito, yung mga kasama pa kasi sa discussion mo kunyari yung different beverages, no, which are not part of your study. So that wala na yon. Ha?
Noted na.
Okay.
Okay, that's all.
Thank you, Dr. Biarco. Next presenter is Dr. Finlay Ann J. Manila Calizo on a crossover controlled experimental study to determine the gastric emptying time and effect on blood sugar levels after consumption of coconut water, sugarcane juice, and plain water among healthy volunteers.